Hi, I'm Matthew Weinstock, Senior Editor for Hospitals and Health Networks magazine. With me today is Todd Ebert, President and CEO of Amerinet. Todd, thanks for joining us today.
Good morning.
The recession has forced a lot of hospitals to be more efficient and more cost-effective over the past couple of years, and health reform obviously is going to drive that even further as we move to true pay-for-performance and bundled payments. How do you think the supply chain is going to impact that, and what role will GPOs play?
I believe that GPOs are very well positioned to be an important player, important solution in controlling costs, bringing more value to the customers, hospitals, non-acute care organizations that we serve. The supply chain that once in the past was maybe not as important as it might have been is now extremely important, and all healthcare facilities are paying very close attention to their supply costs. Will we take a role as collaborators, coordinators? I believe so, as we organize purchasing on a regional basis, and then frankly be able to collaborate or coordinate other events that may bring more value to organizations throughout the communities that we serve.
The reform law also had some transparency requirements for the manufacturing community. There have been concerns from that sector that more transparency be applied to the GPO environment. Are those valid concerns?
I think they are valid concerns. However, the GPO organizations through the Health Group Purchasing Industry Initiative has always been very open relative to transparency. We have worked with and worked very closely with the Senate and all of the oversight organizations relative to the information that is available, and we stand for transparency. We'll continue to work and provide the information that they seek.
You expect, I imagine, sometime over the summer or early fall, a Government Accountability Office report coming out on GPOs and transparency. We don't know what the findings will be yet, but what do you expect the impact of that will be on the field?
It's interesting that as we've been through this process with the GAO and the Senate Finance Committee, all of the GPOs have been very open and very forthright with providing the information that has been requested. Our anticipation is that, and our goal was, this is an opportunity for us as GPOs to tell our story, to allow others to understand the value we bring to our customers, that we're more than just a price in a catalog, that there are many other services and programs that we provide. So we see this as an opportunity for others to identify the value that we bring, and that we'll continue to be able to move forward in a very transparent and open environment and continue to bring value to our customers.
As hospitals look for areas to become more cost effective, where do you see the biggest gains in trimming costs?
There are a couple of areas. First, we've all been as GPOs, been very good and very successful in the commodity side. However, there are a couple of areas where GPOs can be much more successful. Some of those would include the physician preference items, the PPI, the implants, orthopedic, spinal, and cardiology implants. There's still a huge opportunity for GPOs to work more closely with our customers. And then also relative to processes. There is I think a strong body of evidence supports the fact that down the supply chain route and quality, those two are very closely tied together. Standardization, the appropriate use of product does add to quality and reduce costs. So those are a couple big areas that I think GPOs can have a major impact as healthcare reform goes forward.
Improving quality and safety is taking on a whole new level of importance because of the reform law and the emphasis that law places on readmissions and hospital-acquired conditions and other things. Where will the GPOs fit in that area in helping hospitals improve their quality and safety records?
All of the GPOs have an important role in working with their customers from a quality and safety perspective. Each takes a different track relative to how they approach it. Our approach is to work closely with the suppliers that have solutions and our customers that currently do some very, very good quality and safety programs, to work with them to share that information with our customers throughout our organization. But GPOs will have a huge role in working with their customers relative to this very important issue. But it may be approached differently by each organization, which is good, which I see as very valuable.
And lastly, as we come out of what people say we're coming out of, the recession, Give me a sense of the GPO landscape as we move into a recovery period.
I believe that through the last couple of years, that the GPOs, again, as I've said earlier on in this discussion, we're very well positioned because we do bring value to the customers we serve. I do believe that many of the customers have recognized the fact that there are opportunities to help them save money from an acquisition perspective or a product usage perspective. So the GPOs have had much more of an opportunity to work with our customers to bring them value. As the economy improves and we go forward, the GPOs again will continue to be well positioned, primarily because healthcare reform requires the healthcare facilities to be as effective and as efficient as they possibly can, which includes the supply chain and preference items, as well as are we positioned to help facilitate, collaborate relative to bundling of payments, accountable care organizations, et cetera.
Appreciate your time today.
You betcha.
Thanks.
Glad to do so.